The ongoing debate over whether or not to vaccinate recently zeroed in on the immunization for hepatitis B. It's a recommended vaccine for infants, but some CDC advisors say they're not convinced. WREL's PolitiFact reporter Paul Spey is here now with a fact check of some of their reasons.
Some of the CDC's advisors have questioned the need to recommend the hepatitis B vaccine for infants. Hepatitis B is a virus that attacks the liver and can lead to cancer or even organ failure. Let's address some of the comments that were made at the agency's committee meeting earlier this month. Starting with this one, some of the members suggested the vaccine isn't necessary if a child is at low risk for the virus. But first off, many people have the virus but don't know it. It's possible to have hepatitis B but not show symptoms for years. It's also highly contagious. This is from the Philadelphia Children's Hospital. They say the virus spreads through blood and other bodily fluids and can live on surfaces for up to a week. Now, some committee members suggested that low-risk babies may not need the vaccine, but that we've been recommending it to them anyway to protect the broader populace, and that's not true either. Babies are especially vulnerable to hepatitis B because their immune systems are weak. The U.S. Department of Health and Human Services says 90% of babies who contract the virus end up with the more serious complications. But the vaccine works. The first major hepatitis B vaccine was approved for use in the U.S. in 1981. And around that time, about 20,000 cases were detected each year. That number has since dropped. In 2022, the CDC reported a total of about 250 new chronic cases among all people under the age of 19. Now, finally, let's address this last one. Committee members repeatedly compared the U.S. to European countries, suggesting that we are some sort of outlier in recommending the vaccine to newborns, but that's not true. The green on this next map shows where all newborns are given the shot. The other colors show partial vaccination, and the red means no vaccine at all. Of the 194 countries that are part of the World Health Organization, 116 recommend the vaccine to all newborns. Read more about this issue at WREL.com.